After you've seen these pictures, am I going to be a size smaller? Can you even judge that, or you can't until after procedure?
If the fullness in, I'll show you, wait, let me just show you. If this fullness here, and I'll use this, if this fullness here is seen better in the back, if this fullness here and that fullness there made it necessary for you to buy a size bigger and then have the waist tailored.
Yep, I do. That's what I have to do.
Right. So then, yeah, you will buy a size smaller that will fit better.
Okay.
Now remember what I said. Smart Lipo or liposuction is for isolated areas of fullness.
All right.
I find this area to this area an isolated area of fullness. I find this one starts off a little higher, nobody's symmetrical. Oh, you want to see what you would look like if you were symmetrical?
I'm definitely not.
Nobody's symmetrical. Okay. Now what you're going to see is this is your left side. You're going to see your left side with its mirror image and your right side with its mirror image.
All right. The tools of a computer.
Right. So this is if you were left-sided symmetrical. This is if you were right-sided symmetrical, which are two different bodies.
That's weird. That's very weird. That side's so much smaller.
Right. This side starts off higher and goes down a little lower. Everybody's asymmetrical.
Look at that.
Isn't that cool? No,
so my left side's bigger than my right.
Correct.
Ew.
Okay.
All right.
So now, remember what I said. Imagine, oh, okay, now let's go.
Looks like I have to get rid of that muffin top too, David. I'm
well, no, that muffin top there. That you could, your underwear makes this look like it's bulging.
All right.
That's why when I brought your underwear up, you saw that this is a nice contour. So nice contours can be reduced with diet and exercise.
Yeah, that does go away.
Right.
Yeah,
exactly.
It does. This never goes away.
Right. And this is, remember I said it started there and ended there. This is the highest point, and then it fades to lower points. This is where I'm going to take out the most, and as the concentric circles go further and further away, I'm going to take out less and less, so that it's going to wind up straighter like that.
Wow.
Here's the same on your knee. Your knee, see, it's straight here, and then it flares out. Now, everybody's flares out a little bit, but yours flares out a little bit more than desirable. So I would start here, end here. This is the highest point, right there. So take this down so that it's straighter.
That's the only thing my husband mentioned. He goes, "Why don't you do your knees?"
Right.
You want me to do my knees? I said, "I didn't even know you noticed my knees." He said, "Yeah, do your knees."
He notices your knees in shorts and skirts. He doesn't notice your butt.
No, he doesn't mind my butt.
So again, imagine slicing that off. It's not a huge volume.
I'm improving my gams.
Right.
Like a sexy gams. Okay.
Imagine slicing that off. It's not a huge volume, but it would make a huge difference in your leg contour. As this would make a huge, if you didn't have this bulge in a tight slinky skirt or tight pants, that would be huge. Huge. But you're not gonna get on the scale and see a huge weight reduction. It's just not gonna happen.
No, and that's fine. I've never been a number girl.
Right.
It's appearance.
Nobody should be. Which brings to mind, when are you going to see the result? Immediately after the surgery, having suctioned out fat during the surgery, that area of fatty fullness is going to be replaced by swelling. Because even though this is finesse and this is gentle, it still swells. So immediately after the surgery, you're going to look the same. Okay. You might get a little black and blue, but you're basically going to look the same. It takes somewhere between 2 to 3 months for all of this traumatized area to resolve and shrink in. You'll call me at 6 weeks and say, some of it's soft and some of it's firm. Well, what happens is that the fatty layer of your leg absorbs the swelling fluid like water would be soaked up in a sponge. And it takes a while for that fluid to be reabsorbed by your body. The softer areas are getting reabsorbed faster than the firmer areas. So people say, well, is this my end result? I say, well, is it still firm? And if they say yes, then I say, well, then you have a ways to go yet. Once it's as soft as the surrounding skin, that's your end result. And that takes somewhere between
So at the
2 to
end
3
all,
months.
you know, in a year, it will be soft like...
Oh,
you know,
yeah,
like
in
it's
3
like,
months.
Like you won't...
In
No,
3
I won't be
months,
able to tell it.
in 3 months, you, except for those tiny little 2 or 3 millimeter incisions, you won't be able to tell, well, hopefully you see a difference, but you won't be able to feel a difference in the consistency of your fatty layer.
Now, should I massage that area, or...
After 3 weeks' time, massage always helps resolve swelling. So yeah, you could massage it, but it's really going to do its own thing. But massage will certainly expedite the resolution of your swelling.
Okay, so you just made me think. I've been married a couple of years now, but if I had known about this procedure before then, so like brides that get engaged now and their wedding is next, June, this would be a good thing to do now.
Yes.
You
Well,
wanna
with
do
any surgery.
with any event or anything.
With any event. This less so than things that you see, like facial surgery and stuff like that. The sooner you do it, the better. So, but 3 months' time is perfectly long enough to get an end result and a good resolution of the thing. So as long as you allow yourself 3 months before an event, you're fine. Facial surgery, I tell people after a facelift that they'll look good at 2 weeks, but certainly at 2 to 3 months, they'll look natural.
Right.
Especially in pictures, they'll look natural, whereas prior to that, they'll look good. But as they animate, you'll notice some faint problems with swelling such that lips and eyelids and cheeks don't move well. But certainly 3 months is perfectly fine.
I'm not a candidate for it, but I've heard you talk about people doing neck Smart Lipo. And I know there's so many ladies that hate their necks.
Neck Smart Lipo, if your neck is a modest amount of fat and the same or a little bit more of excess skin, Smart Lipo is great. For the most part, we don't do the fat melting procedure in necks because even if you have a fatty neck, it's not that fatty.
Right.
Most of a neck Smart Lipo is the tightening of the skin with a little bit of
if you have to be the right
fat
candidate
suction.
for it.
Yeah, but you
Okay.
have to be the right candidate. Now, it's again, the neck, remember I said that it's not going to rejuvenate the skin so it's nice and taut.
Right.
The neck, your profile, your contour will look great. It's not a substitute for facelift surgery, but it certainly is an alternative that has minimal amount of downtime with an excellent result, such that I would, in the proper candidates, it's going to be wonderful.
Okay. All right.
Okay.
That was good.
Now that's
All
a
right.
lot to digest.
It was a lot to digest, but I've got my markings and I'm going to go home tonight.
So go home and look at it.
And look at it.
Think about everything.
And my husband's going to go, what in the world did you do today?
Think about it all.
Yep.
You're not signing up today. Think about it all.
All right.
Speak to your husband. Come back with questions.
Okay.
If you read anything that you think is different from what I said, or if you don't understand anything, always feel free to call, email me, or come back.
Okay.
And as I said, my job today was to tell you whether I think that you would be pleased with your result, and I think that you'll be very pleased with it.
Because, I am going to be 36, and there you were throwing that number around. In November, I turned 36, so I'm okay. I have enough elastic skin.
You have enough elastic skin.
Oh,
You're an excellent candidate for the operation. I wouldn't worry about the 36 number.
And then as far as scheduling this, I just call the office and say, I'm ready, and what areas I want to do when I decide, knee, leg, arm.
Correct.
Okay.
Yeah. Since we do this here in the office, again, under just oral sedation and local anesthesia, we have much more flexibility as far as scheduling than if we had to bring, a hospital or an operating room into the picture.
Okay.
So we do this every day except Mondays. It is, as I said, a little labor intensive in that it takes a good bit of time. Doing your outer thighs will take me an hour and a half to 2 hours, which is a good bit of time. But you'll be perfectly fine to get up.
It's a lot of time.
Yeah. You'll be perfectly fine to go home, and if you feel up to it, you can go out to dinner that night if you want to.
All right.
Sound good?
Sounds good. Thank you very much.
My pleasure.
Thank you.
Okay, bye-bye.
See you soon.